Respectable viewers and listeners, today I am going to present a comparison between the different masks that are being used nowadays to protect ourselves from the coronaviruses, the COVID-19. Although different kinds of hundreds of are used in the market, but we should keep in mind that they all are not effective, or some are less effective and some are more effective. In this video, I am going to present a reference of two studies that are recently was compiled in August 2020 at Duke University, that how uh, some masks are effective and some are less effective, and even some may be uh, more harmful than providing safety against the coronaviruses. This study was arranged in a Duke University, and it is showing uh, the study suggests that not all face coverings are equally effective at preventing the spread of COVID-19. While wearing face masks or the cloth coverings when you are outside the home is one of the best things you can do to stay safe. Not all the masks are as good at filtering out potentially harmful particles like coronaviruses. In experiments, bandanas, handkerchief, fleece, balaclavas that usually you use during the cold weather gear that covers the entire face except for the eyes, and the neck gaiters, tubes of performance fabric typically used for the running outdoors. These things offered very little protection, while N95 respirators or surgical masks and even homemade cloth masks performed better. Researchers used a laser beam to test the performance of different masks. For the experiments, researchers in the Duke Department of Physics positioned a laser beam in a dark box that would illuminate respiratory droplets as they pass through the light. A speaker then positioned their mouth by a hole to the box and said a phrase while a camera on the other end of the box captured video of the droplets in the real time. Researchers tested almost in 14 types of masks that are shown in a figure in this video. The researchers tested almost 14 common face covering, then analyzed the video frame by frame using a computer algorithm that counts the number of particles visible. Participant said the phrase "stay healthy, people" 5 times into the laser, a total of 10 times for each mask. The neck gaiter that is shown in the figure number 11, which was made of polyester spandex material, performed the worst in the study, actually producing more particles. According to the Dr. Martin Fisher, we attribute this to the textile breaking up those big particles into many little particles. Dr. Martin Fisher said, they tend to hang around longer in the air. They can get carried away easily in the air. So, this might actually be counterproductive to wear such a mask. A bandana tied to cover the nose and the mouth only offered slightly more protection than no mask at filtering the particles. The N95 respirator with no valve, as shown in the figure number 14 in the photo, was the most effective in the study, but experts say that these devices are in short supply, should be reserved for the healthcare workers. A disposable surgical mask made from a plastic derived material called polypropylene, that is number one in the figure, was the next best option, followed by a mask made from two layers of cotton and one layer of synthetic material, as number 5 is shown in the figure. Another recent study that utilized similar technology said that the both face masks need at least 2 to 3 layers of fabric in order to protective, and the CDC recommended use 2 layers of the equilibrating fabric or the cotton sheets for the homemade masks. The mask made from the cotton fabric on number 6, 7, 8, 9, 10, and 13, as well as a knit to shirts, as shown in the figure at number 3, performed about the same, though other evidences suggest that the wearing a cloth may provide protection for the wearer, not just those in close proximity. Interestingly, N95 respirators with exhalation valves did not rank well, and the CDC doesn't recommend wearing these masks, while masks with valves work well at the protecting. This is in under brackets. And in my experience or in my understanding, a mask would be a better protective if the inhalation and the exhalation is kept separated in the mask. It can be achieved by a little manipulation in the mask when you can separate your nose and mouth by providing a extra partition in the mask, because the saturation of oxygen is already less in patients, especially in the elderly patients that are suffering from the respiratory problems or the heart problems. So it would be better if such system would be adopted or designed in which exhalation and inhalation would be separated, and this will increase the quality of life. I pray for the best of the humanity, and uh, I'm happy that some of the countries like Pakistan, China, Sweden, Korea, they are successfully fighting against these diseases. The death rate is almost under 10 in such countries, and I hope the other countries would also be able to compete or the fight against this pandemic. And till the a good vaccine is available for the humanity, we should all take care, and we should all try to boost our immunity system. And we can boost our immunity system by taking the hot wet foods, as has been told by the Greek medical systems, like ginger, like the garlic, like ginkgo biloba. These are very good herbs that can protect us or strengthen our body to fight against any viruses. So please avoid from rush places, from the crowd places, and if a corona is decreasing day by day, you should be aware that a second or a third wave or attack of this virus can happen. So then, what is the best that we should use masks, and such masks that are more effective, like N95 mask and some other masks that have been discussed in this video. Thank you very much for your time. Please like, share and subscribe this video for the benefits of other humanity. Thank you very much.